Well, thanks, Rachel, and thanks everyone for joining us today. We feel this work is so relevant and timely here in the Pacific States, the Southwest, and around the globe. We've all experienced smoke exposure in many different ways. So we'd like to start off with an icebreaker, or maybe it's a cloud lifter, to better understand our audience and to give you a chance to share your experiences. Savannah is now going to lead us through a series of questions and word association activities. So please join us.
All right. Again, thank you so much, Rachel. Thank you for having us. So for our poll today, I'm going to ask you all to get involved. It's not that early in the morning where you are, hopefully. So two ways to respond to this poll. One is to go to our poll link, which I think Rachel has put in the chat, or you can text S. Devlin, which my initial is 884, to the number 22333. And then once you have joined, you can choose A, B, or C. I'll give you all a couple minutes. Oh, someone's already in. That's perfect. I think among this group, we will probably have 100% yes answers to this one if anyone has personally experienced a wildfire smoke event. So again, the point of this poll and icebreaker cloud lifter is really to get people thinking about smoke, thinking about how we experience smoke in different ways. Maybe just a few more minutes to get into the poll. And if you have any questions on how to get in or if it's not working, feel free to put that in the chat and we can troubleshoot with you as well. All right. Anyone still waiting? All right, we have quite a few questions, so I'm going to go on to the next one and you should still be able to join. Okay, next one, slightly more specific. Have you been in the vicinity of a prescribed fire? So moving from wildfire to prescribed burning, so thinking about management techniques. Right, a little more variety here. A couple more people saying no, a couple people not sure, which is absolutely possible. Yeah. I think I would probably answer as I'm not sure too. All right. People feeling okay about jumping in? Seems like it. Okay, so now thinking a little bit more about how different types of smoke has an impact on you. Have you experienced a physical impact from smoke exposure? So that would be acute things like a headache, cough, eye irritation, or exacerbation of any sort of existing disease like asthma or COPD. All right, some people saying no. That's interesting, yeah. Hopefully those are the same people that haven't been exposed to any smoke. All right, so now thinking a bit on the other side or the slightly different side of things, have you experienced a mental impact from smoke exposure? So this would be, I mean, a range of things, but depression, anxiety, smoke fatigue. Smoke fatigue is really up there. Yeah, much more varied answers here, especially those who are quote unquote used to smoke. It's easier to deal with it during fire season and beyond. All right, one more yes, no question, and then we're going to go into some word association. So I know fire season has really already started down there. We just had a big fire start up in Washington yesterday, but it has started. So did you feel prepared for wildfire season before it began this year? Yeah, more no's there. All right, hopefully we can think of some ways to help people feel more prepared. Do people feel prepared now? That's another question, I guess. Yeah, okay, so half the people did not feel prepared. That's really, telling, I think. Hopefully we can talk about some of that a little bit. All right, so for this next question, I'm going to ask you to type in a word, but just because of the way this program works, it gets a little funky if you put a space in there. So if you are putting a 2-word answer, I'm going to ask you to misspell it and put it without the space, please. So when we're thinking specifically about fire management, what group of people comes to mind? So again, try to not use spaces. You can put a dot or whatever. Yeah, federal fire management, Forest Service. Forest Service, yeah. So obviously the bigger words mean more people have put it. Agencies, foresters, agency folks, resource managers, yeah. Community, land managers, agency, firefighters, okay, glad that one popped up. Land managers, medical, foresters, owners, landowners, okay. Yeah, glad firefighters is the biggest one there. I think that makes a lot of sense.
It won't let me type in.
Oh, okay. Maybe try it either with the link or the texting. Maybe try the opposite one. I'll give it a couple minutes, see if you figure it out. You also, if you want, you can put your answer in the chat, and so we'll have it in there as well. That would work too. All right, I'm going to go to the next one, which is a very similar question. What group of people comes to mind when you think of smoke management? So last one was fire management. Now we're thinking specifically about smoke. All right, so air, yeah, air resources, fire and resource managers, air quality, EPA, air quality, yes, glad that's a big one. Managers, burn bosses, resource advisors, municipalities, great. Fire resources, air quality, burn bosses, okay, yeah. Right, so yeah, it's kind of different, slightly different group of people that come to mind when we're thinking about smoke. Okay, and then one more question here. What group of people comes to mind when you think of community wildfire preparedness? So a lot of people said that they did not feel prepared for fire season this year. So who do you think should be in charge of preparing communities for wildfire season? Residents, community leaders. Yeah, community leaders. Glad that one's nice and big there. Local and state officials, fire departments. Yeah, community leaders coming in hot. Okay. Residents, emergency responders, absolutely. Again, municipalities, fire departments, county governments, NGOs, state. Yeah, residents themselves. Gotta prep our own communities. County governments. Great. All right. So then on my last question here, so this was thinking about wildfire preparedness. What about preparing communities for smoke season? So we know that smoke reaches a lot more parts of the country than fire itself does. So is there a group of people that should be responsible specifically for prepping people for this fifth season that we're having, this smoke season? Doctors, yeah, that's a really good one. Public health departments, yeah, health authorities, local media, community leaders. Yeah, none is coming in as the top. Okay, community leaders coming in. Okay, local governments, NGOs again, air managers, health authorities. DEQ, okay. Federal agencies. So what we're hoping is that this exercise has kind of gotten you to think about that there are a ton of different groups that are involved in fire season and smoke season, and getting our communities and our different organizations involved and ready and prepared. So what we're hoping by the end of this presentation is that you will agree with us all that this is really an interdisciplinary crisis that needs interdisciplinary solutions. And so we're going to kind of go into the different disciplines and how we can all kind of come together to work on this together. Thanks for interacting with me here. All right, go ahead, Ed.
All right, I'm probably preaching to the choir here, but as you all well understand, forests that have not experienced fire in many decades, such as the panel on the left, that are dense with thickets of young trees and shrubs in the understory, are prone to more high severity fires that travel up into the canopy, burn extremely hot, and kill a majority of the trees, even the large fire resistant trees, especially as we've seen in the last decade or two. By carefully thinning the understory, such as in the panel on the right, we can introduce fire because we reduce the fuel load, and we can reintroduce fire more safely as a restorative process that will maintain healthy forests over time and end up with different results, with more trees retained on the landscape. So we know that prescribed fire is an important component of that. Next slide. But what we weren't sure about back a couple of years ago was, what is the difference between wildfire smoke and prescribed fire smoke? Is prescribed fire smoke just as bad? And so we worked with colleagues Carrie Nadeau and Mary Prunicki at Stanford University, and together we published a paper back in 2019 addressing this question from a small study. It's a preliminary, first of its kind study. But what we found was that concentrations of pollutants, as depicted on the y-axis, when we compared the concentration of pollutants from prescribed fire versus wildfire, in such pollutants as PM 2.5, PM 10, carbon monoxide, down on the lower row, much higher from wildfire than it was from prescribed fire. And in the upper row, you see nitrogen oxides and polycyclic aromatic hydrocarbons were also higher across all criterion pollutants we measured. Wildfire produced much higher levels of those pollutants compared to prescribed fire. Next slide. So what we wanted to know was, what's the health response? So Stanford looked at the difference in response of children and found that children had much more immune suppression. So the higher the value is, the better response of T cells, Th1 cells, and on the left, on the y-axis. So we're comparing prescribed fire, wildfire smoke versus control, unexposed population. The control has the highest response, so this is good. This is immune response is higher. But with wildfire smoke in the middle, this immune response is suppressed. Whereas prescribed fire smoke had a significantly lower impact on children's response to smoke. So their immune systems were less impacted by prescribed fire smoke, probably, assumedly, due to the lower concentration and duration of smoke exposure from the two types of smoke.
All right, so I'm going to talk a little bit more about the health impacts of smoke. So to most communities, this increased level of smoke exposure is a relatively new phenomenon. And so there is this misconception that we don't really know that much about smoke exposure and how it impacts human health. But as Ed just showed you, we're already kind of differentiating between different types of smoke exposure. So there's a lot that we know. And admittedly, there's not as many longitudinal studies at this point, but we're working on those. And we can say a lot about the acute impacts of health exposure, or the acute impacts of smoke exposure on people's health. And some of those are depicted here in this figure, such as the respiratory effects and the cardiovascular effects, or just the respiratory symptoms that I brought up earlier, such as coughing, eye irritation, difficulty breathing. Those are kind of acute symptoms that an average healthy adult might experience during a large smoke event. And others, people with pre-existing conditions, may experience some more aggressive health effects, such as exacerbation of existing disease, or new onset of disease, even with increased exposure to PM. So during a large smoke event, exposure is going to impact everyone. As I said, there's some effects, some smaller acute effects that will impact even the healthiest adult. But however, just as with other air pollutants, smoke is not going to impact everyone equally. So exposure sensitivity is usually what we think through first. So these are things such as your pre-existing condition, your age. Ed mentioned the study that they were doing was on children, because children are much more susceptible to pollution exposure than adults are. So children and elderly, where you work, if you're working outside or inside, where you live, these are all things that will impact your sensitivity. But there's this second category of adaptive capacity that we really need to think about when thinking about what is the risk of smoke impacts. And adaptive capacity are things that come in such as housing and education. If your house is not well insulated and you're getting much more indoor pollution, you can't protect yourself as well by just staying inside. Wealth, do you have the ability to purchase an air conditioning unit that would enable you to cool down your house without opening the windows during the summertime when smoke is high? So things like that, we really have to take in both exposure sensitivity and adaptive capacity when we're thinking about what the risk of smoke exposure might be.
Sorry, these perspectives, differing perspectives of the prescribed fire and forest management teams and the health perspective have led to unintentionally adversarial relationships between forest fire managers and public health professionals. Many of us in the prescribed fire world look at air quality districts as the enemy who's going to stop us from being able to conduct our prescribed burns. Both sides think that there needs to be trade-offs. We need to analyze these trade-offs. From a forest and restoration and resilience perspective, we need to be able to burn more acres to help forests be more resilient in the face of a warming climate with increase in wildfire, and create less smoke in the long run by doing prescribed burns. From a public health perspective, we need to use other management techniques besides fire to minimize smoke exposure for vulnerable populations. Both of these are reasonable, intelligent, and well-meaning perspectives. This is a situation in which everyone has good intentions grounded in their respective disciplines. Public health professionals don't want to lose our forests in megafires, and forest and fire managers don't want to see people's health impacted by smoke. However, these perspectives taken in isolation can lead to opposing perspectives and opposing actions.
So a couple of months ago, I recently attended and presented at the Northwest Fire Smoke Symposium, which was a collection of academics and policymakers and practitioners from all different disciplines, but all of people who have dedicated their life work to wildfires and smoke exposure. And I did a similar poll that I did at the beginning of this presentation, but really kind of dove into what assumptions people are bringing to the table from their perspectives specific to prescribed burning. And remember, these are people that have dedicated their lives to wildfire, and there was a huge variety of answers. So still people saying we need to completely stop prescribed burning, to people saying we need to up prescribed burning by 100%. And those kind of two different sides, plus a bunch in the middle, demonstrated to me that we're still really working on this. We're still kind of trying to bring these different perspectives together and kind of get rid of some of those assumptions that may be kind of enabling some of these preconceived notions about the other perspective.
So to help bridge this disciplinary gap between the two areas of expertise, we turn to the Science for Nature and People Partnership. It's a organization formed in 2013 at UC Santa Barbara in a decision theater there. And it's a partnership among the Nature Conservancy, the Wildlife Conservation Society, and the National Center for Environmental Analysis and Synthesis. The idea was that there are many pressing nature and people problems in this world that could be better addressed by bringing these different groups together by intentionally bringing these diverse groups together and through facilitated workshops, help discuss and come up with a position paper or some other product that explores this difference and chasm. Our SNAP working group convened in the spring of 2020, just as the pandemic was starting. Despite the limitations of working in a virtual only world, we didn't get to use the decision theater down at UC Santa Barbara. We managed to bring together scientists and managers from an amazingly diverse array of institutions. The original goal of our working group was to develop a consensus-driven, evidence-based approach to identify and communicate the health implications of wildfires versus ecological management, including prescribed fire and managed fire.
So our SNAP working group was originally separated into 3 different work streams. So some people doing modeling, others doing a more of a policy piece, and then this third work stream, which we're going to talk about today, which was our framework paper. And when we first got our work stream together, so a bunch of interdisciplinary co-authors coming to write this paper on both how we can integrate public health and health equity into forest and fire management and how we can work in an interdisciplinary way. Originally, the paper was completely different. It was very, very long and was basically just a spilling of all the different opinions that people had from each discipline. And so we had to kind of take a step back and think about both what are these fundamental truths or things that we come to the table with that we are very important to our discipline, and where can we overlap with each other. And so through many conversations, we came to this goal of finding a common ground to provide a transdisciplinary view of how forest and fire management, specifically prescribed and managed fire, intersects with human health through the impacts of smoke, and then articulate the need for a more integrated approach. So it was this idea of smoke, which is where we really all overlap. So the air quality people, the public health people, the forest and fire managers. It wasn't the fire itself, but the smoke that comes from the fire. That's where we need to address as an interdisciplinary team. And so we were able to do that. This is our paper, which Rachel has already posted in the chat. Thank you, Rachel. Hopefully most of you all have read it already or have it open in a tab to read sometime soon. If not, go ahead and click on that link so that you can read it. As I just mentioned, the final version of the manuscript really ended up revolving around how we could find a common ground among the interdisciplinary group of co-authors that we brought together. And how that worked out in the end was to develop a list of 6 different consensus statements. So how could we all agree on something? And the wording and language for these statements were selected really carefully and reworked many times. So as we present them, we're going to read directly from the slides to really show the importance of the wording and language here. So our first consensus statement is we recognize the need to listen to and integrate a diversity of perspectives, in particular those embodied by Indigenous peoples who have successfully used fire as an ecological tool for thousands of years. So hopefully this one is pretty self-explanatory. This one came to us, the first consensus statement came to us pretty easily. As part of a SNAP spinoff project, a colleague and myself conducted interviews and focus groups with community leaders in North Central Washington, and to really understand people's perceptions of prescribed burning. And this region of Washington is right on the border of the Colville Reservation. So we were interviewing tribal and non-tribal members. And overall, there was really a great enthusiasm for prescribed burning, but there were nuances between the tribal and non-tribal participant answers, with the tribal interviewees bringing in more action-oriented ideas and language to help improve and increase how we manage forests with fire. So this second statement, prescribed fires in addition to managed fires for resource benefit are both necessary management techniques to keep forests resilient and to lessen the negative ecological and public health impacts of wildfires. So this is one of those fundamental truths from the forestry and fire disciplines. We need fire to fight fire. That it didn't really immediately sit well with the public health folks. And as someone who did her dissertation in the health impacts of air quality or air pollution, it didn't initially sit well with me either. And there were many misconceptions about how other types of management could be just as effective. And it took a lot of one-on-one conversations and group conversations to really break this down for the public health people that both prescribed and managed fires are absolutely necessary. And in going through our takeaways afterwards with co-authors, this is one of the public health folks' kind of greatest takeaways, is that management is not going to be effective without fire and smoke. And coming to that understanding was really important for all of us.
All right, the next consensus statement is that certain regions of the Western US will experience more smoke days with heightened use of prescribed and managed fire. However, we expect the impacts of smoke exposure to be reduced over the long term in comparison with untreated land burned by wildfires. With these techniques, exposure in affected communities can be planned and lessened. Emphasis added on planned, because the example I'm going to give is from Oregon. Last year, people developed the first of their kind community response plans according to the rules set out in Oregon State's smoke management plan. And these response plans have been adopted in places like Ashland, Bend, Baker City, Burns, and Lakeview. These collaboratively developed plans have involved fire managers, air quality regulators, public health agencies, city fire departments, local elected officials, and others to establish the mechanisms needed to share real-time information through a range of channels and processes. Next statement, number 4. No degree of smoke exposure is without risk. However, additional investment in advanced preparation for affected populations can lower associated health risks. A smoke-resilient community is resilient to smoke from any type of fire. So similar to Savannah's comments from the second statement on the necessity of prescribed and managed wildfire, this is one of the fundamental truths that was at times difficult to accept for some of the forest and fire collaborators. I recall a statement made several years ago at a fire-related conference that, quote, people just need to get used to the smell of smoke. Our SNAP-mediated collaboration has helped highlight that this type of dismissive perspective is not really very productive.
So our 5th statement is we must work to promote both equity in process, who has a say in decision-making, and equity in outcomes, who gets exposed to smoke, within those communities and populations experiencing disproportionate impacts from smoke. So this statement is really who is in the room making decisions and who are the people being impacted by these decisions that are being reached. The part of the statement that really rings important for me is the need to reach community members that may not have access to traditional channels of information sharing. In that same spin-off project that I mentioned earlier, we were looking really around risk communication in this part of Washington to identify the ways in which communities are prepared or not prepared for smoke exposure. And something that came up really frequently in our conversations were that among the populations that were getting exposed, the communications or the risk communications were not reaching them. And some of these communities, such as the farm workers depicted here, or those that are living in much more rural areas.
Next statement, number 6. We are missing opportunities for positive impact by working as separate disciplines. We recommend that further and intentional integration of forest fire and health disciplines, including the practitioners, tools, and resources, needs to occur to lessen the human health effects of smoke exposure due to prescribed and managed fires. And to further this work, we took heed from our own advice and hosted a workshop for practitioners and managers in the smoke, fire, and public health space. At the beginning of the workshop, we had presentations by local community workers, and there was some tension that arose between a community health worker and a forest manager. Throughout the day, we worked to break down barriers and find common ground to demonstrate each of these statements in practice. And by the end of the day, these two people were sitting at the same table discussing how they could work together in the lead up to this fire season. So we have hope. We know that more can be accomplished, and this is just the start to making it happen. But it takes a deliberate effort to reach out and work together.
So I'm going to talk a tiny bit more about that workshop that Ed just mentioned. In kind of moving beyond this academic sphere into the more practitioner and manager space, we talked to a lot of practitioners and managers. And one of the things that we realized or we found is that many practitioners and on the ground people don't know their cross-disciplinary counterpart. And so we designed this workshop to really bring those local practitioners together and start to form those relationships and collaborations. And so the main goal of this workshop was to foster new interdisciplinary relationships and partnerships at the practitioner level. So this workshop happened back in November of 2021. Because of COVID, we did it hybridly. So we had about 20 people in person and about 20 people online, all local to Washington. So one of the things we realized is that in working in this space, this is a local problem. Each community needs to tackle this individually. And so, or at least create these relationships with their local counterparts. And so we focused in on Washington and had participants from all different disciplines and really tried to kind of spread them out as much as we could, but had forest and fire folks, public health folks, some government officials, both state level and local. We had the mayor of Okanagan there as well, which was fun. And how we kind of worked through the workshop is we had presentations from local experts, and then we broke down into smaller group discussions to really talk about what was heard and plan for next steps. And so some of the conclusions from the workshop is that it went well, which is great. We had almost 90% of participants say that they were able to form new meaningful connections during the workshop. And 76% of participants said they would be following up with someone as a result of the workshop. And the majority of those, 90% of those, said that follow-up would involve crossing disciplines. And one of the questions that we asked at the very end was, if you were 10 times bolder, if you had all the resources and all the connections that you could possibly want, what big idea would you recommend? And so I'm just going to share a couple of those with you. One seems pretty simple, but I think is really important, that long-lasting collaborative partnerships need a foundation of trust among participants. Secondly, more robust communications group for public outreach and education, more use of prescribed burning, bigger programs and resources, and larger outreach on the benefits of prescribed burning. And the last big idea is to build smoke-ready communities, create a new organization, state level, with communications experts, project managers, consultants, etc., to provide community support and smoke action plans. And this type of thing should be interagency funded, so through DOH, Ecology, DNR, etc., to really get communities ready for smoke season. And then, yeah, so we have these big ideas, and now the next step is what do we do with them? How do we take these consensus statements? How do we take these big ideas and move from the idea phase into action?
So we're going to run through a couple of examples of strategies that we're currently using in California that may have beneficial application in other landscapes. They're just some things that we're trying out, and we're interested to hear from others if these types of activities are already being practiced in your communities, or if they may have some application or traction in the communities in which you work. Next slide. So we all use smoke screening in our burn plans to help identify our affected public entities. We could probably do a better job of informing people, including the type of information we give people beyond just you're going to be exposed to smoke, and start to include the message that there are some steps that people can take to increase their adaptive capacity and reduce their potential impacts due to smoke exposure. Here's an example of a coordination meeting that we started practicing back in 2018. Continue. This is an example agenda from a 2019 workshop. This is a one-day workshop co-sponsored by the Nature Conservancy and the Tahoe National Forest, and includes things like a weather update and predictions. So we had NOAA come in and talk about just how dry was this summer. It seemed really dry to me, but how dry is it compared to history? And then also some information from California Air Resources Board on using the online data serving platform to inform each other of what's happening. We had a Forest Service emissions specialist and climatologist, Lee Tarnay, talk about emissions versus impacts. And then we had a round robin from all the prescribed burners, limited to about 5 minutes, because that's about all we needed for this smaller portion of the Central Sierra Nevada, to talk about what they're planning to do and how many acres they're planning to burn, and at what time of year. This is leading up to the fall burn season. So we had folks from National Forests, from private land, NGOs, and also from state agencies. And then we had each of the air quality management districts or pollution control districts within that airshed talk about their concerns and relay information that may not otherwise get across to some of the prescribed burners. And it was really interesting because we had a long and robust conversation, the 5 minutes each, turned into about 20 minutes on creepy piles, which is an expression for pile burning that's allowed to wander between the piles. And the air quality districts had some consternation over people basically conducting a broadcast burn while they're doing a pile burn. So it's good to get kind of air that dirty laundry and talk through how we might better communicate and work together on solving that. And then we also talked about messaging and notifications, and including better information and notifications to the media and public. So that's one example. The other is some work that we started in 2019 with the American Lung Association. We started talking with them about prescribed fires and presented some of the data that we had conducted with the medical researchers as prescribed burning as a method to help mitigate wildfire emissions. And you have to recall in California, this is on the heels of big wine country fires in 2017, the Camp Fire in 2018 that burned up 20,000 homes and killed almost 90 people, and other big fire years that we've had. And the American Lung Association commissioned a report that came out last month. And it's just so great to see this headline, that prescribed burns can mitigate health harm from worsening wildfires. This is just exactly the messaging that we need to have go out to our public, and to have it come from a health entity rather than just the prescribed burners themselves or a land management agency, I think goes miles towards improving people's perception of the importance of conducting prescribed burns. Lastly, we've continued our collaboration with Stanford Medical, and they're conducting health studies. And because of the pandemic, they are now mailing test kits to people after people are informed and then agree to participate in a study. So we're putting this QR code out for people to be able to participate in a study. And I encourage others in your region to reach out to other academics and institutions that are involved in understanding health impacts and see if there's an opportunity to work with them. Because as a prescribed burner, I'm going out to communities to talk to people about their community wildfire protection plan or their prescribed burn association. And we're putting this QR code in a lot of our PowerPoints just to let people take a snapshot and potentially participate in a smoke exposure study. So those are just a few examples of some of the strategies that we're using to understand smoke management. And yeah, so pass it on to Savannah.
All right, well, that is how we're going to conclude our presentation today. We know we gave you a lot of information, but hopefully kind of demonstrated how all these different disciplines really come from different perspectives, but we're all kind of working towards the same thing, right? Improved forest health and improved human health. And so if we can bring together, follow those consensus statements using the examples that I gave and Ed gave, there's opportunities here to move forward, and we have hope that can be done. So thanks so much for your time and your attention, and we're happy to answer any questions for the next few minutes here.
Great, thank you so much, guys, for that great presentation. We'll go ahead and start with a comment and a question from Mark. He said, in Utah, our state fire agency is very excited about shifting to a new prescribed fire model where a small crew burns small areas daily over a period of 4 to 5 weeks in spring until a few thousand acres are treated, rather than having a prescribed fire event where a large team burns the same sized area on a day when conditions are best. This reduces peak smoke exposure but lengthens the period of mild smoke exposure. Do we know if one of these approaches has fewer public health impacts than the other?
That's a good question. Go ahead, Ed.
Well, I'll just say I don't think we know. I think it's a great strategy, and some national forests are taking a strategy of developing a NEPA document for their entire national forest so that they can conduct a prescribed burn when the window opens. But again, we're early in the process of understanding the production of smoke, amount of smoke, and what's in it, and then from the health standpoint, how that affects our populations. So I don't think we know, but I think it is worth studying.
Yeah, worth studying, and I think also worth kind of improving the communication around that. Like, you obviously described that really well right there. And so are like the public health entities in this region aware that change is happening, and what kind of changes may that instigate on their end? And I think that, yeah, giving them the chance to make those changes is something we're advocating for.
Thank you for that answer. So Laurel had a question. She joined a little late, but was wondering if you've looked at or worked with people in places where fire and air quality folks have strong relationships, like the Southeast Fire and Air Quality Working Group.
Oh, go ahead, Ed, if you have. So our paper is specifically kind of focused on California, Oregon, and Washington. But yeah, we talk about that as kind of examples of these people are doing a good job working well, and kind of the plug there would be to also integrate the health folks into there, right? So fire and air quality seems to be kind of the first step, is to get those people aligned, and then bringing in the public health folks or the community-based organizations to really kind of tie those 3 disciplines together is what we're hoping for.
That definitely makes sense. Hannah had 2 questions. First, they were curious if you know how receptive or collaborative industrial forests are on this issue. And second, do you have any thoughts on how this conversation is different in frequent fire or low severity versus infrequent and high severity fire regime forests?
Ed, do you have a response on that one?
Yeah, let's take the first question first. Sorry, can you give me a quick synopsis? I lost my thoughts when I was distracted by the second question.
Yeah. Do you know how receptive or collaborative industrial forests are?
Right. Yeah, so in California, it's the only one I really know about. There's a major industrial forestry organization company that has said that they're not going to use fire anymore. They're not going to use prescribed fire. It's just too risky and dangerous. So I think that they're, it's easy to kind of short circuit that to say they're not really interested in they're worried about wildfire, but they're more interested in management from a mechanical standpoint. And the second part of that question was about
Do you have any thoughts on how this conversation is different in frequent fire, low severity fire versus infrequent, high severity fire regime forests?
Yeah. I don't know exactly. I think that there's much less activity in the infrequent, high severity, infrequent occurrence, high severity fire landscapes, such as higher elevation or chaparral systems. There's more mechanical treatment in the lower elevation and chaparral. But I think that, you know, the health impacts are still similar with as far as how much quantitative material is burned and smoke produced with more frequent management than with lower frequency, high severity fire in those systems. But again, there's just the research is lagging behind the management as far as I know.
I think one of the points from, I think, our 4th or 5th consensus statement, where it talks about how a smoke-ready community is prepared for smoke from any type of fire. And I think that that's something to emphasize here, is that we, from the public health perspective, there can be an impact from smoke from any type. And so if we can really prepare communities to be smoke-ready, it will not matter as much where the smoke is coming from.
Yeah, thanks for driving that home. I have a couple of questions from my coworker, Asan, who's on the call. The first one is that institutional barriers and siloing are real. And you sort of answered this in your presentation, but are there others who have successfully integrated human health, smoke, and clean air mitigations that we can learn from?
People are working on it. I mean, there are smaller local examples, right, where communities have done a really good job of working together. And I think this is one of the things we learned from our engagement workshop, is that it takes those kind of one-on-one connections with people and kind of breaking down those barriers to kind of move bigger. And so we had that example Ed gave of a forest manager and public health person kind of at odds at the beginning there, and then coming together. But I think that, though, starting with those introductions and then kind of moving into what are the assumptions, and then moving into, okay, what can we do with the resources we have, and what are the ideas moving forward, which seems very simple. But I think we have to start there. I think we have to start with kind of breaking down those assumptions and starting with, in your region, who are your people that you can make those connections with, and hopefully that's not too difficult. Go ahead, Ed.
Yeah, so two examples that come to mind. First, we talked about in the presentation, the community up in Oregon in Bend and a few others developing those smoke mitigation plans at a community level. I think those are great examples. And then in California, we have the California Air Resources Board, which oversees all of the management districts. They have a quarterly meeting where they get together with a group that's called the Air and Land Managers group. And so they meet quarterly and talk through issues and bring in experts. So I think those are just a couple of examples of breaking down those barriers, at least on the management and smoke emissions side, but less so on the medical or health impact side. But those two could be grown into something that's more along the lines of what we suggest through our paper.
Okay, this next question kind of builds upon that. And again, you gave some examples in your presentation, but we know that we need to work more with public health and FEMA, Homeland Security, and more. So, what are the first steps we can take to make that happen? And then building on that, we know that communication is a key piece. So how can we encourage that, especially regionally or locally?
Yeah, I mean, I think that idea that Ed brought up, that there can be this kind of misconception from the forest and fire side that we need to just get used to smoke. And so making sure that as we are approaching health folks, that we're not coming with that attitude, like coming with the understanding that the majority of public health folks, their perspective is any type of smoke can be harmful. And so really starting there with, okay, we recognize you don't want smoke, but how can we help to prepare the community for smoke that is, I think, relatively, should be universally recognized that smoke is going to be inevitable, right? And smoke is not just on the West Coast, but across the country and in the Southwest, obviously. And so what can we do to prepare for that inevitable smoke, regardless of where it's coming from? I think kind of reaching out with that, kind of, lending a hand to what can we do to help prepare the community better. I don't know if that answers it.
Yeah, and my suggestion would be to start small and just, start local and reach out if you're not already coordinating closely with your air resources managers to make sure that there is some communication beyond just my project, my interests, to think more broadly about community interests. And then if you know academics in your area who are interested in air pollution or meteorology or anything related to this integration of management and health impacts, to invite them into a meeting and just to discuss your interests and start to develop a relationship that might blossom into something more substantial that involves some research and coordination.
It's always the hard answer of start small and put in the work to build it up. So we have just a couple of minutes left. If anyone has additional questions, please put them in the chat. We did have a comment from Mark. He was asking about, what is managed fire or fire that's managed for resource benefit? And we sort of went back and forth, and he ended up saying that essentially, I think what he was asking was, in your research, did you guys look at the difference between smoke that came from like full suppression or other types of wildland fire versus managed fire as far as its impact on health? Is there any way to differentiate? Did you look at that?
So on the research that Savannah and I were involved in and led up here is really focused on a kind of a broad brush look at all managed fire. And that's why I use that shorthand. We use that shorthand of managed fire really is about wildfire from natural ignitions managed for resource benefit. But I think, again, we're just kind of scratching the tip of the iceberg. The work with Stanford was really focused on differentiating between a wildfire event on a small area versus a prescribed burn of similar area. And so this is, it's early in the research realm of differentiating different types of managed wildfire or deliberate fire. So I think we're, it's too early to say, well, let me just phrase it differently. I think we need to know more about those different management strategies and their concomitant health impacts, and invite others to get in the game there and help us figure out how to do that.
We do. So one of the work streams from our larger SNAP working group is a modeling work stream where they're looking precisely at that, the different management types and what the exposure levels might be from the health perspective. And so stay tuned for that research and when that's coming. And then there's also, so like Ed said, our framework paper is very broad strokes, but some of the co-authors within there are also working on similar papers looking at how the exposure from managed versus prescribed versus other forest management techniques. So yeah, there's research out there that's happening, but like Ed said, it's early.
Yeah, I'll look forward to seeing that when it does come out. So
yeah.
Well, we're just about at the top of the hour. I want to take the time to thank you both again so much for being here today, for giving this great presentation, for getting involved, and I look forward to working with you in the future. So thank you so much.
Thanks so much for the invitation.
Yes, thank you.